from someone who has atrial fibrillation in the heart, because the atrium is just quivering instead of squeezing. So a blood clot can form because the atrium doesn't squeeze. So that blood clot can go straight up through the carotid and into the brain. So a lot of people who have ischemic strokes get an echo to see if they have blood clots in their atrium, and they get an EKG to see if they have AFib. So we're going to watch a video in a second. So it's a sudden occlusion of a blood vessel or because of a thrombus or an emboli. And a thrombus is just a clot that forms, and an emboli is a clot that traveled, usually from the heart. It's usually because they have atherosclerosis and coagulopathy issues. Their blood's clotting. This is why we put people on aspirin, right, to thin the blood. Embolic strokes are associated with atrial fibrillation because the atrium is just quivering instead of squeezing, and the blood clots in there because it's just quivering. So let's look at this video here that I have on, ooh, that's not too long. I wanted the stroke one. I thought I opened it. Hold on. There it is. Okay, I got the stroke one. Here we go. You can see the visual of the stroke.
A stroke occurs when the blood flow in part of your brain is blocked. After just a few minutes, the starved brain cells begin to die. Normally, the brain receives blood via two major pairs of arteries, which branch throughout brain tissue and supply your brain cells with a constant flow of oxygen, glucose, and nutrients necessary for their functions. In one type of stroke, ischemic stroke, an artery in your brain narrows or becomes completely blocked, preventing normal blood flow. The blockage may be caused by a blood clot, also called a thrombus, which forms in an unhealthy artery of the brain. The lack of blood flow causes the tissue the artery supplies to become starved or ischemic. Similarly, the blockage may be due to an embolus, a blood clot that forms elsewhere in the body and travels to the brain. The embolus lodges in a narrowed artery and obstructs blood flow.
Now it's going to talk about bleeding strokes,
In
hemorrhagic.
contrast, during a hemorrhagic stroke, abnormal bleeding disrupts normal blood flow. For example, in an intracerebral hemorrhagic stroke, a blood vessel bursts, spilling blood directly onto your brain, while robbing the intended tissue of nourishment. Both the hemorrhage and ischemia destroy brain tissue. A subarachnoid hemorrhagic stroke occurs when a weak spot in a blood vessel wall, called an aneurysm, bursts and leaks blood into the tight space between your brain and your skull.
So, when someone has an aneurysm that ruptures, it's going to bleed in that subarachnoid space, so where the cerebral spinal fluid is. So if someone ends up having that thunderclap headache, some cranial nerve deficits, things like that, vomiting, seizures, where do you think, the blood's going to be in the cerebral spinal fluid, in that subarachnoid space, because that's where those blood vessels, when they rupture, that's where those blood vessels are. And so when they do a lumbar puncture, what do you think they're going to see? Blood. Instead of clear fluid, they're going to see blood. And that's how they know an aneurysm has ruptured. Also, they can do CT scans and MRIs. So a hemorrhagic stroke can be just bleeding from usually severe hypertension, or a hemorrhagic stroke can also be a ruptured aneurysm. And when aneurysms rupture, they rupture in the subarachnoid space. Now, subarachnoid hemorrhage can also happen from trauma, like a head injury. Okay, so we can have subarachnoid hemorrhage as a head injury or as a ruptured aneurysm. So, let's keep going.
The high pressure bleeding results in serious damage to brain tissue.
Okay, this is going to be med-surg. We're going to leave that there. The treatment's going to be later. So let's get back to it here. Okay. So you can see this is the area right here is where the blood clot was, or the blood clot was right here. And so this whole area is not getting circulation. And so this is the ischemic core. So this is where this part is dead. But the penumbra is the part of the stroke where the cells haven't died yet. Remember, necrosis can be reversible. So they're undergoing the early stages of necrosis, but they haven't died yet. And you're going to learn in med-surg, we do certain things to save the penumbra. If you go to a neurofloor, you might see signs around saying, save the penumbra, because we're trying to get circulation to that part of the brain to, help the patient have the highest level of functioning possible. So pretty much that's the penumbra or the evolving stroke, and we're trying to reverse all that. To prevent all those toxic substances like we saw secreting and causing more damage. So, now that was an ischemic stroke, which is the blood clot or the emboli, the thrombus or the emboli blocking something. Now the transient ischemic attack, that's something where someone comes into the ER, they might have weakness on one side, they might have facial drooping, they might have slurred speech, they might have aphasia where they can't talk, but then it goes away. They're sitting in the ER and all of a sudden it reverses, it all goes away. So it's usually maybe a small blood clot that literally just dissolved on its own, or just a narrowing of the blood vessel. And that also tells us that they are at risk for a full-blown ischemic stroke. So if someone comes into the ER for a TIA, they're at very high risk of having a stroke. Okay, so there's usually, we'll give them blood thinners and stuff like that to hopefully prevent that stroke. But it's usually because they already have cardiovascular disease. They have the arteriosclerosis and all that stuff building up already, just similar to the heart circulation issues. It's a temporary disturbance. Temporary. And so there's a little module here we can watch. Okay, good. So we can watch, you can see the circulation. We're kind of highlighting this area here. We're going to watch this simulation here. So you can see the blood's flowing. So a tiny piece of clot comes off the carotid and it lodges. And then you're going to watch the clot lodge here. And then we're going to have symptoms, but then the clot usually just kind of dissolves on its own. And then the symptoms just go away. Or it can be just a narrowing. Sometimes the blood vessel just narrows. But this person can throw another clot because they've got that cerebral vascular disease. They've got arteriosclerosis or something like that. So, all right.
So this one kind of, I don't want to say you don't want to but kind of go away.
The symptoms go away, yeah. But they have had an assault to their brain. Because that whatever, it could have been 8 hours, 6 hours, whatever, they're not getting oxygen to a certain part of their brain, And it's a red flag that says, oh my gosh, you are going to have another stroke. So we gotta do everything we can to try to prevent that. But they usually do end up having another stroke. So, yeah. It's a very high risk situation. Okay, so that's a TIA. Any questions on that? TIA, transient ischemic attack. So now we've got hemorrhagic stroke, and like I said, one of the ways they can bleed, they can have that intracranial bleed. You were asking about the intracranial bleed. It's these teeny tiny blood vessels from chronic hypertension. Someone's refusing to take their meds, or they don't even know they have hypertension, and those blood vessels just boom, boom, all that pounding, and they get this kind of weakened artery, and then it ruptures, and this is a hemorrhagic stroke. These patients don't do well. The ischemic strokes do better than hemorrhagic strokes. Because this is not only, now we have bleeding in the brain, but all that blood is going to cause vasogenic edema and things like that. So it's usually advancing age and hypertension. The pathogenesis, intracerebral hemorrhage, can cause focal hematomas and edema, compression of brain contents, spasm of the blood vessels. The blood vessels will spasm. If they spasm over here, then we might have a stroke somewhere else because they're spasming and getting narrow. So again, they'll have a lot of the symptoms of increased ICP, vomiting, headaches, and focal symptoms. So if it's on the right side, they'll have left-sided weakness, etc. Now this is a hemorrhage to the basal ganglia. The basal ganglia, just think deep inside the base of the brain, is usually where these blood vessels rupture in a hypertension. And they'll have the contralateral hemiplegia. So left side of the brain, right weakness, contralateral, opposite side. Okay. And they can have, that weakened side could be spastic or flaccid. So that's one type of hemorrhagic stroke. The other one is the ruptured subarachnoid, ruptured aneurysm that causes a subarachnoid hemorrhage. Now the thing is, when blood gets into the brain, it irritates other blood vessels and again causes vasospasm. This is what happened to my niece. She bled in a certain part of her brain, but it irritated her blood vessels that she had bilateral ischemic strokes from the vasospasm. And that's what got her, really. They had treated her sooner, and she wouldn't have bled so much. She wouldn't have had such a devastating bilateral strokes because of that vasospasm. The blood vessels don't like blood in the brain matter. The brain matter is not supposed to have blood in it, right? It's just supposed to have the blood vessels. And it's due to a weakness. A lot of people have congenital deficits. There's something called arterial venous malformations, hypertension, alcohol, and smoking. My niece did smoke, and we think she might have had undiagnosed lupus. Lupus can weaken blood vessels and cause these aneurysms. So we're wondering if the smoking and the undiagnosed lupus, maybe. Some people, and so her two brothers had MRIs thinking they were congenital and they don't have aneurysms. They were worried that her two younger brothers would get it too. So, but they did. All right. Any questions on the two different types of bleeds? Hypertension and then the ruptured aneurysm. All right. So subarachnoid hemorrhage, ruptured aneurysm has its own clinical manifestations. Yes, they'll have increased ICP, but the big thing is they have, if it's not ruptured, if it's just sitting there, they may be asymptomatic. So my niece had an aneurysm and didn't know it, right? Asymptomatic. But when it ruptures is when they're going to have that thunderclap headache. Bam! All of a sudden they have the worst headache of their life. Nausea and vomiting, dizziness, level of consciousness changes. Nocturnal rigidity is when the neck is stiff. You try to bend the neck and they kind of curl up and the neck is very stiff. Photophobia, that means the lights hurt. They can have cranial nerve 2, 3, and 4 deficits where they can't see very well. They have blurred vision. Their pupils will dilate, and then cranial nerve 4 is not being able to see inward. That's why they'll have double vision. So blurred vision, diplopia is double vision. Focal injuries depending on where the aneurysm ruptured, and cardiac dysrhythmias. The brain doesn't like all that blood in the brain tissue, and it causes cardiac issues. And it is going to cause that cerebral edema, that vasogenic edema, increased ICP, and the pituitary gland that sits right there gets squished on, and it can mess with some of the endocrine issues. And the patient can have massive release of catecholamines, and that's why they have cardiac dysrhythmias. So they get the epinephrine, norepinephrine release. I participated as a nurse in a study where we gathered data of patients who had ruptured aneurysms if they had dysrhythmias, and this is the study that claimed it was the catecholamines that did it. So it was pretty cool. I just collected the data on the patients, so that was interesting in California. So this is another thing that could rupture in the brain. This is very rare. When babies are in utero and their brain circulation is actually developing in utero, a small area of the brain, instead of having artery, arterial, capillary, venule, vein, like it's supposed to go like that, those are the capillaries right there. There's an area of the brain where it just becomes a hot mess of blood vessels. And it's called an arterial venous malformation because it doesn't have the arteries. So over time, they're born with it. Over time, 13-year-old goes to wrestling or plays, a sport, and they're getting their blood pressure up because they're playing a sport, and all of a sudden that sucker will rupture. Or a 30-year-old's jogging on the treadmill and it ruptures. Because usually having sex, any kind of way that increased intracranial pressure happens, and it'll rupture. A lot of patients, again, this was going to cause a subarachnoid hemorrhage, so it looks like an aneurysm. We had one of my husband's students at the high school. He worked out in Florida. The young man, he was a captain of the team. He was a senior. He scored a touchdown. Didn't have a head injury. Yay, touchdown! Collapsed. And we didn't even know. Healthy kid. He had one of these, and he bled so much he became brain dead, and his mother donated his organs. So yeah. So she was an amazing woman. I'm surprised. She was on the news just talking about organ donation and being, my son had a healthy heart, healthy lungs. He just had this abnormal thing. And it's very rare, guys. It's very, very rare. It just happens. So, yeah. All right. Now, these are clinical manifestations of a stroke or a TIA. So, if the left hemisphere is damaged with a stroke or that temporary stroke, that TIA, we're going to have paralysis on the right side and weakness on the right side, right? And we're going to have a right visual field cut. So if you do this when you're assessing them, like, can you see my fingers? They're not going to see your fingers over here. So they'll have a peripheral vision blindness. Now, because it's the left hemisphere, 80% of patients have their speech in the left. They're going to have a form of aphasia. So expressive aphasia is you ask their name and they're like, the plumbing is broken. No, what's your name? The plumbing is broken. They think they're saying their name and they're not. It's expressive aphasia, okay? And it's called bocas. Now in Spanish, what is the Spanish for mouth? Boca. So broca, boca. So it's the motor of mouth, being able to speak and move your mouth. Now receptive aphasia is the Wernicke's aphasia. If I talk to my patient, I might sound like the Charlie Brown teacher. Wah, 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 wah. And they're like, I'm speaking to them, and I sound like a dog barking. They don't understand it. So Wernicke, they say, what? Wernicke, they say, what? What'd you say? They can't understand language. So we're going to see on the left hemisphere, we're going to see the different types of aphasia. Now global, they don't understand what you're saying, and they can't speak very well. They have word salad or they don't speak at all. So they have both. Bless you. Altered intelligence and then slow, cautious behavior. That's left-sided. It could be a stroke, it could be a head, it could be an epidural hematoma on that side too, or a subarachnoid hemorrhage, right? Anything on the left side. Right hemisphere, so we have the right hemisphere. So paralysis or weakness on the left, right? Visual field cut, so they're going to be blind in their peripheral vision over here. Spatial perception, so they're not going to be able to put their pants on. They're going to be like, their body in space, they're just not going to feel their body in space. This is weird. They're very distracted, so almost like an ADHD thing. Impulsive behavior, poor judgment, and lack of awareness of their deficits. This is really weird. It's something called neglect. You can put their hand on their chest and they're like, that's your hand, that's not my hand. And they won't feel it. And they won't see one side of their face. So they might be putting their makeup on or shaving their face and then they put makeup on one side. They can see their face, they don't perceive it. It's very weird. And then you put their plate in front of them, they'll only eat half the food because they don't perceive the other half. Their eyeball works, but they don't translate, the vision doesn't translate over. So you have to kind of move the plate over here so they can see the whole plate. So yeah, interesting. It's very interesting. All right, so that's your symptoms of a stroke. It's just gonna be right or left. Okay, so know the right and left. So we have aphasia, and like I mentioned before, Broca's aphasia is motor or expressive, being able to speak. And I always say the Spanish for mouth, being able to, is boca. So boca, broca, kind of go together, being able to speak. Wernicke's is receptive, and they can't perceive the speech. It doesn't sound like speech. It sounds like a dog barking or Charlie Brown's teacher. And they always say, what? What did you say? So Wernicke, what? Helps you remember. What did you say? They don't understand language. Global is both of them. They don't understand and they can't speak. Okay? All right, so they're going to have cognitive issues. They can't think anymore. They can't, judgment issues. Like I said, the language, their body in space, like being able to put their clothes on. Short-term memory issues, concentration and memory. They might have a short attention span. Their reasoning is impaired. You might show them some keys and go, what do you do with these? Oh, I'm going to put them in the microwave. No, they're car keys. I mean, they're like, you're supposed to say drive a car with them, right? Okay. So the risk factors for stroke are going to be similar for cardiovascular disease. So as we get older, we get that arterial sclerosis, more males than females, African Americans than Caucasians, and Latino. Having a stroke in the past or a TIA, family history, mom, dad, aunt, uncle, sister, brother had strokes, hypertension, or especially untreated hypertension. The smoking, diabetes, that is high blood sugar. That high blood sugar, if it's not controlled, contributes to the plaque buildup in the blood vessels. Hypercholesterol and hypercoagulability. This is why we might give people an aspirin a day, keeps the stroke away, keeps the heart attack away. Okay. Let's do a question. So, this morning, Miss Smith is still in bed when the aide comes in to check on her. Miss Smith is leaning to the right and drooling from the corner of her mouth. She is unable to respond verbally, and the right side of her body is paralyzed. These signs are most likely a consequence of, give me your fingers, 1, 2, 3, 4. Yeah, you guys got it. Weakness, it's B, weakness on the right side of the body, stroke on the left. So good. You're getting the signs and symptoms. Awesome. Let's do another one. Because of the location of Miss Smith's stroke on the left, she is likely to experience, it's on the left, she's going to experience aphasia. Because 80% of patients have their speech center on the left side of their temporal lobe. So good. All right. Due to lack of time, if we have time, we'll go back and do these, but these will open up at noon and you can do them on your own. So I just want to get to the seizures, but any questions on strokes so far? Now, those symptoms of a stroke can be hemorrhagic or ischemic. It doesn't matter. It's just if it's happening on the right or left. I just want to clarify that. They can be ischemic or hemorrhagic. It's just if it's happening on the right or left. Okay, seizures. So the seizure is abnormal behavior or movements by abnormal electrical discharge of your neurons. So they can be sensory. They can smell things, hear things, see things, taste things. They can have motor, those jerky movements. They can have autonomic, like heart rate goes up, respirations go up, feeling of butterflies in their stomach, or psychic things. Like my patient said she had out-of-body experiences, right? So the cause, it's kind of common in the peds, you're going to see this again, Sometimes we don't know why they're having seizures, idiopathic. Anybody who maybe has a serious illness, especially head injuries, the acute injury or the recovery of a head injury, metabolic issues, we saw calcium, sodium, magnesium can cause seizures, right? Infections, tumors in the brain, drug abuse, vascular lesions, and congenital deformities like aneurysms or AVMs. So the word epilepsy is the word used for chronic seizure disorder. Okay, they have seizures chronically, reoccurrent seizures. So the pathogenesis of seizures, caused by alterations in the cell membrane permeability or distribution of ions across the cell membrane. We talked in pharm about those sodium calcium channels, and some of those meds alter that. Another cause of decreased inhibition. We're not inhibiting those neural pathways, so they're too excitable, causing a seizure. Neurotransmitters are imbalanced as well. We talked about the GABA in pharm. Some epilepsy has to do with some genetic mutations, which I'm not going to go into, but they'll usually do a full genetic workup if someone has constant seizures. And of course, get a full history. Did you ever hit your head? You know, things like that. Now, the types of seizures, we got focal, generalized, and unknown. Focal onset seizures are just one hemisphere. One hemisphere, either right or left, is having this altered electrical activity. And only one side of the brain is firing abnormally. So the patient can be completely aware, or they're have an impaired awareness. Okay, so I've got some videos coming up, but it's only one side of the brain. Now, a generalized seizure is the whole brain. It encompasses the right and left. It crosses the reticular activating system. The reticular activating system is what keeps us aroused, awake, and alert. So these people lose consciousness. They lose consciousness. They're not with us. So I talked about the absent seizure where they just go. That person is having a generalized seizure, both hemispheres, but they're not consciously present they cannot take in any stimuli and interpret it. So now we have unknown when the manifestations and symptoms are not seen. So now the generalized, again, both of these can have motor or non-motor symptoms because an absent seizure is non-motor. They're just staring off, right? So let's look at this. Focal, generalized and focal. Generalized, the whole brain, involvement of the RAS. So we've got tonic-clonic. So that's when tonic, they go tight, they usually fall down, and then they have full body, like the clonic phase, which is the rhythmic twitching. Myoclonic is just one little jerk, or a couple jerks, or maybe the face, the arm, one area. Clonic is just lots of rhythmic jerks, maybe just one arm, rhythmic jerks. Tonic is just tightening. Atonic is what we used to call drop attack. They usually just go flaccid, they fall down. This is where they get head injuries or break their hips because they fall and hit their head. And the non-motor is usually absence, just that staring. A lot of children have this and they outgrow it. Now, there's something here at the bottom called prodrome or aura. That's the beginning of the seizure. That's their feeling. They may tell you they smell roses, they get butterflies in their stomach. And that is literally the seizure starting, the beginning of the seizure. And usually if they're going to pass out, they go to a safe place and lay down and be safe. Now, the focal seizure without impairment or of consciousness or awareness, focal seizures, observable motor or autonomic components, so they can have like increased heart rate, they can twitch if they, on one side, but they're alert. They can have like this psychic phenomena, like they think they hear ghosts or things like that. Now, the focal with impairment is focal seizures evolving to a bilateral convulsive seizure. That is where the seizure goes from focal, but it recruits the other side of the brain, and now it's become generalized. So the focal seizure can recruit the other side of the brain, which now we got both of them going on. And they can evolve to the generalized like tonic-clonics and stuff. So it can become generalized. So here's Mr. Simpson showing us, we have the aura phase where they have lightheadedness, dizziness, confusion, hallucinations, they hear and smell things. And then the tonic phase is when they go tight. And then the clonic phase is when they have the rhythmic jerking. And then there's something called post-ictal. They're very tired because their neurons have been hyper-firing. So it's like their neurons and their muscles have been running a marathon. They're exhausted. They can be confused during this time and sleep for many hours. Okay? And they need the rest. All right. So now we're going to watch this little girl, focal seizures with awareness. This is a British.
It's really hard to explain what happens in my seizures, because it's like being in a dream or something. First of all, I get butterflies in my tummy,
That's her
and
aura.
then I get this weird feeling. It's like nothing else I know. I can hear people talking around me, and it's like they're slowed down, or they're talking in a different language, because I can't understand them at all. I can't.
So what kind of aphasia does she have?
Don't know.
Wernicke what? Because she can't understand them. So she gets this, but she's completely alert. Like, I hear you, but I can't understand you.
I know that there's stuff going on around me, but the world doesn't make any sense anymore. Apparently, sometimes I say funny things that don't make any sense. And if someone tries to ask me a question and I don't reply, it only lasts about a few minutes, but I feel like it goes on forever. Afterwards, I'm okay, but I usually have a headache and need to go for a rest for a bit.
Post-ictal.
My friends know that it's because of my epilepsy. They help me go and find somewhere quiet or take me back to my dad's.
If someone has epilepsy, this means that they have seizures.
Okay, I'll stop there. But she had awareness. So she could hear people, but she couldn't understand them. And she attempted to speak, but she had Broca's aphasia. She had global aphasia, both Wernicke's and focal. And she had that autonomic butterflies in her stomach. That was the aura, and that tells her she's about to she's having the beginning of the seizure. And she's post-ictal. She has a headache and she's tired. That's the post-ictal. So cool. Okay, let's watch another video. This guy is impaired awareness.
You can see in looking at the chart, we're looking at least a 10% increase from our first quarter to our second.
Adam?
So myoclonic movements, and usually messing with their clothes in a rhythmic manner. What is she doing?
You're
She's
okay.
timing it.
You're fine, you're okay.
Okay.
He's having a seizure.
Smacking the lips. He starts to wander around. That's scary. He could run into a car, right? Fidget with his clothes, unusual behavior. They look like they're intoxicated.
Relax, it's okay. You're okay.
Do you need help? Do you need me to call 911?
No, it's not an emergency. You're okay, Adam. You're okay. Do you mind pushing back the chair, please? Thank you.
He might be able to hear her. He might. Don't restrain them.
You're fine.
It happened again?
You just had a seizure.
He's going to be tired. Post-ictal.
You sit down for a minute. Guys, this happens to me sometimes. I have epilepsy. This happens to me sometimes. Just bear with me for a couple of minutes.
Take a break, everybody. Yeah. So that's impaired awareness. I mean, he's like walking, he's, you know, but you can see where policemen, or some people think he's drunk or something, right? So interesting. So yeah. Okay, let's go on to the next video. Oh, this is tonic-clonic. This looks scary. What? Tonic? And they usually fall backwards. Breathing's irregular.
Excuse me, ma'am, can you please pass me my sweater and my bag over there? Okay. Sure, what happened?
She has epilepsy.
Should I call 911?
No, that's okay.
Stiffens and they fall backwards. Usually backwards. You see she's looking at her watch, because if it goes too far, that's status epilepticus. That's a dangerous.
It's not an emergency.
Okay, now we're clonic.
Are you supposed to put a spoon in his mouth or something?
Don't put anything in his mouth. This is more med surge, but
Honestly, if we put anything in his mouth right now, he's gonna either choke or he's gonna break his teeth on it. The best thing we can do is just wait it out. We just gotta make sure he's safe and there's nothing around where he can harm himself.
they might urinate on themselves or have a bowel movement. This is the postictal phase when they're tired, have a headache, maybe a little confused. That's why we turn them on the side.
Just breathe, I'm here.
All right. So, a little visual there. Does that help? It was pretty interesting. I'm glad we found these videos. So good. So, any questions on seizures? Pathogenesis. Okay. Because it kind of links to how we treat it with farm when we talked about that on Thursday, those of you who were in farm. So the status epilepticus is a seizure that doesn't stop. And this is where it's a medical emergency, so you can see the increased electrical activity, and they can stop breathing. And so this is when, you know, they need to be, they can have, we talked about the phenobarbital, IV drip in farm, and they get put on a ventilator to control them. So we can stop those seizures with the phenobarbital drip. So this is just a seizure that doesn't stop. And that's why they talked about in that video, call 911 if the seizure doesn't stop, right? So, all right. So, any questions? That's kind of the end of the neuro stuff. I find this stuff fascinating. I am a neuro nurse. I like the cardiac stuff too, but I like all of it, but I just love it. Now, why don't we go ahead and play those cahoots, like I mentioned earlier. So we did part 2. So let's do part 3. And again, these are gonna open up at noon, you can play them on your own. Should we get out of the way? So you can scan. Give you about 30 more seconds to sign on. Okay, let's do this. True or false? A subdural hematoma is usually from rupture of arterioles in the brain. So it's false. It's a rupture of what? Veins. Veins. This can happen in a trauma or the elderly, people with alcohol, alcohol abuse, things like that. All right. Silly impala. Subarachnoid hemorrhage is most commonly a consequence of good. Well, cerebral aneurysm, and the picture here shows someone who has a headache, and they have the what? Thunderclap headache, right? The sudden headache, because it's the aneurysm rupturing that causes the sudden headache. Okay, and that is a red flag. Oh, we got the genius gecko selling insurance. Characteristics of epidural hematoma include, and these are CT scans of these bleeds. Yeah, they'll lose consciousness, have a lucid interval where their neuroexam's intact, but they will quickly decline because it's what kind of a bleed? Arterial. Yeah, exactly. Okay. Melodic gaiter. Most severe head injuries are incurred in